Hi folks, this is Dr. Mike and I hope you've had a Merry Christmas or a Happy Hanukkah. At this point, it's time to start thinking about 2013. So here at the American Academy of Health, Fitness, and Rehab Professionals and PostRehab.com, we want to help you actually start to move into 2013 and build stronger practices, connect more with medical professionals, and most importantly, produce great outcomes for your clients. So, happy 2013. When we started our program back in the 1990s, we started with the concept of post-rehab fitness, the idea of getting referrals from doctors, therapists, and chiropractors and working directly with their clients or patients. And we started this as a result of a pretty bad situation we had where we referred a patient out for an exercise program and she came back pretty mangled by a personal trainer. We thought it was incumbent upon us to develop medical exercise and post-rehab guidelines to disseminate to the fitness community. Well, since then, this whole concept of post-rehab fitness has morphed into corrective exercise training along with medical exercise training to combine into a new arena we call medical exercise services. So what we're going to start doing in 2013 is really concentrating on this idea of medical exercise training, which encompasses these other two, corrective exercise training and post-rehab training. So let me tell you a little bit about medical exercise training. This is going to become bigger and bigger as we move forward into this decade and into the next decade. We're finding that the population is embracing this idea of exercise being the key in managing their medical conditions. Medical professionals are starting to realize that exercise is the key in managing most medical conditions, and most importantly, insurance carriers are starting to realize that also. So here at PostRehab.com, we're going to give you more information to manage all that, to produce better outcomes and build a better practice. So let's talk a little bit about medical exercise training. It's nothing more than managing medical conditions with exercise, simple as that. So what we're going to do over the next year, 2013, we're going to give you more information on anatomy and pathology of various medical conditions. I know sometimes it gets a little bit fuzzy. We're going to do more video-based offerings, shorter videos-based offerings, where we're now going to look at anatomy and pathology for individual conditions. We're going to do some of those live on site here in Houston, as well as doing some of those by videotape so that you actually, wherever you are around the United States or Canada, you can get that information. I should also say around the world, you can get that information. We're also going to spend more time looking at the assessment process, doing more video-based assessments, actually showing you how the assessment process should work so you'll understand what the medical professional is looking for, but also what you, the fitness professional, should be looking for with the medically based and post-rehab client. We're going to talk more about progression and exercise selection, particularly with this idea of now managing the medically based client. We get from a lot of you, you're not sure where to start the client, you're not sure how to progress the client, and you're not sure what exercises are the best ones to be done. So we're going to give you more exercise and exercise selection and progression guidelines through video-based programming and also on-site courses here in Houston as well as around North America. We're going to also move into an area that's going to become more important for you, especially as insurance carriers started looking at this idea of medical exercise training, and that area is outcomes. We now need to move away from the idea of simply saying the client feels better or they lost weight or they're stronger. We now need to start looking at the idea of quantitative measures. What happened with their glycosylated hemoglobin? What's happened with their blood pressure, their cholesterol levels? How much range of motion have they improved? How much has their strength level improved? So we now need to start coming up with numeric values for that. And over the course of the next year, we're going to give you a lot of information, guidelines, and show you how to now measure outcomes from a functional standpoint and report those to doctors, therapists, and chiropractors, as well as to insurance carriers. And the last thing we want to look at in greater concentration is the idea of communication. I found over the last 18 years traveling all over North America, the biggest problem we have with our medical exercise specialists, post-rehab conditioning specialists, medical exercise program directors is the lack of effective and efficient communication with medical professionals or the complete lack thereof. So we want to spend a lot of time teaching you how to communicate with medical professionals so you now can start to build great relationships, get more referrals, but most importantly, start to show the medical professionals through effective communication the great job you're doing with managing their patients and their clients. So this is essential. So a couple new things are going on here also. We're offering a new program starting in 2013 called the Medical Fitness Training Workshop. This is an entry-level program. It is not a certification. It's an entry-level program to get you started with the idea of medical exercise training. We realize the economy is still pretty hard out there for a lot of fitness professionals. So if you would, go to medicalfitnesstrainer.com to get more information on this program. Now, if you've already gone through our MES or PRCS program or MEPD program, the medical fitness training probably isn't going to be for you. But this is a program designed to help get you the entry-level medical exercise professional, post-rehab fitness professional, get you in and give you the exercise guidelines and techniques you need to start effectively managing your clients a little bit better. Another new thing, if you don't know this already, we're now in Texas. That's right, folks. I got my cowboy boots and we're here in Texas. We're actually broadcasting this, or videotaping this, I should say, in Houston, Texas, in this Christmas Eve. And we now have a new address here in Houston. We're at 22136 Westheimer Parkway, suite number 349 here in Katy, Texas. We've actually combined forces with one of our medical exercise program directors, Jason Hodge, and his company, Medical Fitness Pros. We actually wanted an on-site facility, a medical fitness-based on-site facility, so we can now start giving you better guidelines, more quantitative ideas on how to measure what's going on with your clients, and give you more exercise techniques, and also do more on-site course offerings here in Houston so you can actually see how this is supposed to work up close and personal. So over the course of 2013 and beyond, we're going to do more things here on-site in Houston. We're going to do more one-day courses and two-day courses all over North America. But what we're always also going to do is give you more video-based offerings, more live offerings here in Houston, so you can actually learn a little bit more and then apply that information right away. We realize traveling is difficult. You can't get away from your clients, your families, everything else. So we're going to try to do more here, and we're going to try to make this the facility to give you everything you need to connect with your clients, produce better outcomes for your clients, connect with medical professionals, and most importantly, build a stronger and better practice. So we look forward to working with you in 2013. We wish you the best in building your medical exercise practice, and we're going to make this the year of medical exercise services. So thanks again for joining us. We look forward to working with you in 2013, and please visit us at PostRehab.com to get more information on our programs, or you can email me at drmike@PostRehab.com. Again, thanks for being with us. Have a great 2013, and we'll see you on the other side. Thanks again.